back to another episode of Real Talk. My name is Alina and I'm your host for the day. So I'm a holistic nutritionist and also your lead editor here at the Hearty Soul. And now if you watch our episodes every week, you'll realize that our regular co-host Nadia is not here, but we do have the exceptional Dr. Christine Cho here with us today. Welcome to the show.
Thank you. Thanks so much for having me here.
For sure. So Christine is actually a naturopathic doctor, and she focuses and specializes in pain management, which is so amazing for this topic today. She's also specializing in things like digestive issues, hormonal balances, weight loss, so she can talk about the whole gamut, but we are going to focus on pain management. And she actually, in her practice, does work with elite athletes as well and was a former one herself. So this is what she does on a day-to-day basis, working with holistic treatments and natural remedies when it comes to chronic pain and joint issues. So again, super happy to have you here. For today's show, I am also going to be monitoring the comments as well. So please, if you guys have comments for myself or Dr. Cho, just write them in. Of course, we can't give very specific medical advice as always, but any questions you have around joint pain, arthritis, natural remedies, we're going to do our best to answer them for you. So I will, time and again, be checking in over here. Okay, so with that being said, we can get started with today's topic, which is, why do my joints hurt? So this is a really popular topic with our audience, and hopefully a lot of you are very excited that we are going to talk about this right now, because many of you may, wake up every day and have very stiff joints or in pain all the time. We know because you guys are always asking for natural pain remedies and supplements to look for. So we are going to talk about that today. And one of the things I do want to mention off the top is this isn't just an episode for you if you have arthritis. So if you have arthritis, perfect place to be in. But if you also have warning signs or are worried about getting arthritis or just have joint pain and want to have answers on how to prevent it from getting more serious, this is a great place. So the first thing that we're going to talk about and have Christine talk to us about as well is, the difference between when there's just arthritis versus normal joint pain. So arthritis overall is, an inflammation of the joints where, the cartilage starts to break down and degrade, and, people try to basically repair it, rejuvenate, and you're looking mainly for pain relief. But how do you know when there's really a warning sign of actual arthritis versus, just stiff joints in the morning? So what are your thoughts on that?
Yeah, so with osteoarthritis in particular, you're sort of looking more at X-ray imaging as well, and as well as the signs of stiffness in the morning, joint stiffness overall. With just regular day-to-day joint pain, non-arthritic conditions, you're really looking mostly at does it go away after a reasonable amount of time? Does it get better? Does it not last too long? So is it not more of a chronic pain type syndrome?
Okay, cool, thank you. And now that we sort of understand that distinction, it's very interesting to note that there are 350 million people worldwide who actually do suffer from some form of arthritis. And the two main types that people are familiar with are osteoarthritis and rheumatoid arthritis. So there's a very key distinction between the two, and we're going to talk about that a little bit more in depth. So with osteoarthritis, that's more of like a general wear and tear on your joints, usually, due to like maybe if you're a bit overweight, or sometimes it just happens with age, or there's like repetitive motion. That's osteoarthritis, and it's usually just around the joints. Whereas rheumatoid arthritis is another kind of the main types of arthritis, but that's more of an overall autoimmune condition, and it affects the whole body on a systemic level, including the joints. But, Christine, you mentioned that there's more than just these types of arthritis. So what are the other types out there?
Sure. So under the umbrella of I guess, inflammatory arthritis. You're really looking at autoimmune type conditions, so rheumatoid arthritis being potentially one of the one of the symptoms or manifestations of a larger autoimmune picture. So even places or conditions like lupus, you might see a type of inflammatory arthritis or arthritis associated with STIs. Whereas osteoarthritis, you're looking primarily at the structure, less destruction around the joint, and less of an immune response to the inflammation.
Okay. So how do you actually go about diagnosing this? Like, how would a medical doctor tell someone that they have rheumatoid arthritis versus osteo, let's say?
Sure. So osteoarthritis is primarily diagnosed through symptoms and imaging or x-rays.
Okay.
Rheumatoid arthritis, you'll do some blood work as well. So you may see the presence of rheumatoid factor above normal levels. You may also see other symptoms, so other systemic symptoms like general malaise or not feeling great, fatigue, maybe some skin manifestations as well, so rashes, nodules, that sort of thing.
And the rheumatoid part, that sort of refers to sometimes a fever, I guess. Is that common, or?
Yeah, so it's referring more to sort of joint or bone destruction as well. Yeah.
Okay, cool. And then, you know what, actually, before we get into the causes and treatment, guys, we are going to dig a little bit deeper and have Christine talk to us about that. We actually went out on the street this time and just asked people. So this is the first time we're doing this. We went out as the Hearty Soul team and asked people on the streets of Toronto, what are their thoughts on joint pain? Do they have it? What remedies are they looking for right now? What do they think causes it? So yeah, we're going to roll that for you guys right now, and let's see what people say.
Do I have joint pain? No, I don't.
Yes, sometimes I do have joint pain.
I do not have joint pain.
I do.
What causes joint pain? I haven't actually thought about it that much.
Not taking care of your joints, like putting a lot of stress on them.
I think gaining weight and age can cause joint pain.
I think sometimes the cartilage has been diminished, or an injury, previous injury that hasn't fully healed.
I think in certain cases there is a way to reverse joint pain. I think one of them might be weight control.
I have probably heard of some creams that you would rub on the area.
Well, there seems to be a fair number of supplements you can take.
I know from my own experience of having a knee injury, and I had a sore joint, that actually exercise and swimming and so on, and different types of physiotherapy were very helpful.
Overall, live a better, healthy lifestyle.
Do I take any type of joint pain medication? I do take an ibuprofen every once in a while. I don't take painkillers on a regular basis.
I do not take painkillers for joint pain.
Sometimes I take Tylenol.
I wouldn't take painkillers. I would usually try to relax or take a soak, a warm soak in a bath with Epsom salt.
I have a 93-year-old mom, though, who takes medication for her joint pain, and she takes glucosamine and chondroitin.
Do I know the side effects of painkillers? No, I don't.
I do. Yeah, I don't take any pills at all like that.
I understand that the negative side effects of painkillers are usually they're hard on your stomach or your liver.
Obviously, you don't want to get addicted to a painkiller if you can avoid that. I think that's really an unfortunate side effect.
I guess I'm more into the natural vein of living and try and look at it with natural foods or things the body will use as opposed to just masking the pain.
I'm willing to try natural products versus pharmaceutical remedies.
I mean, obviously, things that are more natural tend to be a lot safer.
I do prefer natural remedies over medication because it has less side effects, obviously. Unfortunately, not every natural remedy works as fast as most people would like.
I mean, I think sometimes people have to, if they have severe pain, they have to have something to address that. So you have to check these things out carefully with your doctor, and also maybe with a naturopath if you have one.
All right, welcome back. Hope you enjoyed that segment. So what you may have seen from that those conversations that we were having with people is that we were surprised. A lot of people are really into the natural remedies and understand that there are some risks with painkillers and really try not to turn to them that much and are curious to learn more about how to use those natural remedies. And we see that people do have a basic understanding, mostly when it comes to osteoarthritis, it seems, that, you know, being overweight or like that wear and tear, just day-to-day repetitive movements are actually what's leading to joint degradation. But there are so many other factors, similar to the hypothyroid conversation we had last week with Dr. Loken. When it comes to hypothyroid or something like an autoimmune condition like rheumatoid arthritis, there's so many different factors at play, and that's what we want to educate you on. So we're going to dive into that right now. But first things first, what does the doctor prescribe at the moment? So let's say you know that you have osteoarthritis or rheumatoid arthritis. There are some things in particular that when you go to a doctor, they're going to hand to you. So I'll touch upon these briefly and get Christine's input as well. But sort of you see the first couple ones here, analgesics and non-steroidal anti-inflammatory drugs. Those are the ones that sort of kill the pain. And the anti-inflammatory drugs in particular kill inflammation. But of course, this is more of a Band-Aid approach, right? It's not really getting into the root cause. Are there any side effects of these that people should be wary of?
For sure. So when you think about analgesics like Tylenol, for example, you're looking primarily at liver toxicity as being one of the key side effects. With NSAIDs or anti-inflammatories, you're looking at increased risk of GI bleeding. So you want to be really careful with patients like that. Those are sort of the primary concerns that we have with those.
And do you see that people are using them like people who come to you, how often are they sort of popping those pills every day?
Yeah, so I mean that's a big problem because it is sort of just symptom management, right? So they are taking multiple doses on a daily basis.
Okay, okay. And you know, it's interesting, I actually just read a study a few days ago, and they were saying how non-steroidal anti-inflammatory drugs like ibuprofen can basically degrade the cartilage further. So what you want in arthritis is you want to prevent further degradation of the cartilage and basically try to help repair it, and you want pain management. So while this is giving you the pain management, it's actually deteriorating your condition a little bit more. And I'm not sure that people are really aware of that.
I don't think so. I think it's something that needs to be a conversation among medical doctors and other healthcare practitioners as well with their patients.
Yeah, for sure. And then the other three very common things that are given by doctors, and now these are more for if you have an autoimmune type of arthritis, so rheumatoid arthritis, injections are still one that's used for osteoarthritis. So this is usually hyaluronic acid injections, and I believe these are your favorite, maybe?
Yeah, in terms of efficacy, the hyaluronic acid injections do tend to provide a lot of symptom relief for many people. It also has fewer side effects, so more like local pain and sort of not chronic swelling might be one of the results of an injection, but overall they sort of have less of an adverse effect profile.
Okay, so you would say it's kind of the safest out of the top three over here, like the analgesics and the non-steroidal drugs.
I would think so at this point.
Okay, cool. And then the last two guys is more the corticosteroids, and I'm going to try and get this acronym right. Disease-modifying anti-rheumatic some things. It's something. Do you know the last one?
Anti-rheumatic drugs.
That's the one. Okay, these guys are used more for things like rheumatoid arthritis because they suppress the immune system. Now, what's some of the dangers there with suppressing your immune system in the long run?
So obviously then your immune system can't function appropriately. So although with autoimmune conditions you're sort of looking at trying to downregulate the immune system over time, definitely you can sort of see an increased immune system response. So potentially getting sick quicker. With corticosteroids, we're worrying about degradation of the joints as well over time.
Okay, do they actually help repair the joints in any way, or it's just suppressing the inflammation?
Pretty much like everything else we have out there right now, it's more about pain management and anti-inflammatory response.
Okay, so as you can see, guys, with a lot of these conventional treatments, of course they are providing relief, and we all understand, of course, if you are in a lot of pain and that's all that's going to help, you're going to do what's best for you or what your practitioner gives to you. But it's very crucial to understand that this is not helping repair your cartilage. It's just helping with the pain management aspect of it and symptom suppression, and there are some side effects. But definitely the safest one is the hyaluronic injections, which is actually helping the cartilage become a bit more flexible,
right,
I guess, as well. Okay. So now that we understand what some of the treatments are, what about the root cause? So this is what us holistic practitioners and naturopaths love to talk about so much, right?
Yeah.
What is really the root cause? What is going on so that you can address it at the core? So we are going to look at the root causes of both osteoarthritis and rheumatoid arthritis. But before we get into that too, you should know that you can kind of say the more definitive causes, I guess, for osteo.
Sure.
But for rheumatoid arthritis, it's kind of hard. Like, we know evidence shows that it is an autoimmune condition, so that's for sure. But the cause of that autoimmunity is not so certain right now, but there's a lot of risk factors, I guess, we can talk about. Would that be correct?
Yeah,
Okay.
for sure, yeah.
All right, so now that we get into a little bit of the causes of osteoarthritis, so some of the top ones, of course, is being overweight. It's putting pressure on your joints, certain injuries, repetitive motion in your job, having a deficiency of certain nutrients as well, like vitamin D or vitamin C. But Christine, in your opinion, what is, of all the people who've come in with osteoarthritis to your clinic, what's the one that stands out the most, or the top 2 or 3 that you see recurring?
Sure. So I would say that age for sure is a factor. So that kind of goes along with frequent use of the joint, as well as the repetitive movement. So construction workers that hard or manual labor jobs, that can also put quite a strain on your joints.
Okay. For sure. And in terms of certain nutrients, is there one that stands out to you as well?
I don't think so in terms of a key nutrient deficiency, because it is so dependent on the actual basically usage of the joint. There's sort of a multifactorial relation, but not one key.
Okay. Awesome. So that's sort of the osteoarthritis aspect. And I know that Christine mentioned that there's so many other types of arthritis, but we are going to talk again just a bit more about this autoimmune one, rheumatoid arthritis. And again, these are risk factors, not direct causes. But so actually, first thing you should know too is that while genetics does play a part in autoimmunity, especially for rheumatoid arthritis, experts do agree that it's the environmental factors, though. It's things like your diet and your environment. So certain lifestyle and environment things that trigger or switch or are required for rheumatoid arthritis to take place. So some of these here, some of the top 3 ones are, things like smoking, which increases the risk by around 8-fold of rheumatoid arthritis. Things like silica exposure, so silica dust if you work in a construction setting or oil and gas fields. Low antioxidant status. Again, so if you're not eating enough fresh fruits and vegetables, so there's more free radical damage. And now the last 4, I'll let Christine explain a bit, but these are all related to the gut. And so food allergies, leaky gut, dysbiosis, which is an imbalance in gut bacteria, and pesticides in your food. This is all to do with gut health. So why is gut health so prominent here?
Yeah, so we forget how important the digestive system is to immune health overall and health overall, because a lot of the immune system actually does its work or starts out in the gut. So when you're not eating properly, or when your immune system, when your digestion is not working well, then that will lead to a whole host of problems, which I'm sure you've covered previously on other shows. So when we think of autoimmune conditions such as rheumatoid arthritis as potentially starting off in the gut, or the gut contributing hugely, it's because of that reason that the immune system resides in the gut as well.
And could you explain the concept maybe of leaky gut and how that would potentially lead to something like RA?
Sure. So when you view digestion or your gut health as sort of or including mucosal lining. So all throughout your intestines, there is a lining that shouldn't be very permeable. So it can let some things through, but most things should, such as food, should stay within the lining.
And it's apparently 1 cell thick, right?
Yeah, so it's microscopic.
Yeah, it's like tiny.
But it's super important.
Yeah.
So when you have a leaky gut, it means that maybe there's inflammation going on or something that's causing the gaps to sort of widen, and so more things will leave the intestines and then go into the bloodstream, where your blood cells and your immune system cells will sort of start to recognize food or whatever it is as foreign bodies. So then that's sort of when maybe the body might start to overreact and try and get rid of those things, and that's potentially where autoimmune conditions
causing more of that inflammation as well.
Yep.
Okay.
Exactly.
And I guess the imbalance of good to bad bacteria is something that leads to more of that leaky gut condition as well, right? That dysbiosis.
Yeah. So when you view or when you look at treatments as well, probiotics being sort of a key thing in autoimmune conditions, you're looking to balance the gut flora in order to sort of affect change in the immune system.
Yeah. Apparently there was a study done too, which showed that the more you had small intestinal bacterial overgrowth, I guess SIBO, the more severe your symptoms actually were for rheumatoid arthritis. So they've also seen, I think, a difference in the fecal flora of people with rheumatoid arthritis and without it. So there's definitely that connection there, like you said. Yeah. Okay, guys, so those are, again, some of the risk factors, not the direct causes for RA. But now we need to get into the nitty-gritty of, okay, how do we actually treat it then, since there's so many different factors, and we're going to cover osteo and rheumatoid arthritis both, but we are really looking at a root cause approach, integrative nutrition approach as well, of how to go about this. So the first thing, so we've outlined around like 5 different steps or main stages that someone would want to go through. But the first thing you want to do is really set the foundation. So these are just basics, right? Again, you can't go taking all the turmeric in the world, let's say, to kill off inflammation if you're not going to do some of these basics to protect your joints and reduce inflammation. So the first thing here is, obviously reducing some weight if you are slightly overweight right now. Exercising, because isn't exercise how nutrients diffuse, I believe, in the joints?
I mean, when you talk about just increasing circulation overall, right? So getting the blood flow to your joints, trying to get, the inflammatory proteins out of there. So you need the blood flow to get in and out.
Because I think that's a misconception that people have too, that if you have arthritis, don't exercise, it's going to hurt your joints. But it's kind of the opposite. You do.
It's a huge factor, and often sort of what we grade progress on is the ability to do simple weight-bearing exercises.
Oh, okay, very interesting. And now in terms of low-impact exercises, so that's what someone would want to go for, right, with arthritis, so things like swimming. Are there any other exercises you would recommend and recommend against?
Sure. So depending on the stage of arthritis, I guess, and really it's more about what kind of pain are you feeling and is that pain lasting? So if swimming works for you, then great. You still want to get your heart rate up. So doing laps is great, doing a water aerobics class is great, but also things like yoga can be really great for the joints. And anything that you can tolerate. So even if it just means going for a brisk walk. So it's really up to you to decide what exercise you're able to tolerate.
And I've heard about isometric exercises being good. What exactly is an isometric exercise? Sounds very technical.
So basically just making sure that the muscles are functioning properly. So working on specific muscle groups to get the activation there. So when you're talking about osteoarthritis, for example, and one of the major joints being the knee that's affected, then making sure that the muscles surrounding the quads are working, surrounding the knee, such as the quads and the hamstrings are working well. So working on contraction and those.
Awesome. That is a good explanation. So guys, that's sort of more the weight loss and exercise angle, but then the other 2 things that you want to do when it comes to your diet as well Of course, you want to up your antioxidants, fruits and veggies, all those good things, and reduce inflammatory foods like your processed foods. And then it's very important to understand the link between, you know, having a low sugar diet as well and contributing to arthritis and joint pain. Because studies have also shown that if you are insulin resistant, you know, so if there's too much glucose traveling around in your blood, not only is it increasing inflammation, but it's actually preventing the regeneration and repair of cartilage as well. So you definitely want to bring your blood sugar into balance. And actually, now that I'm talking about diet, I know some people will have the question of, you know, Mediterranean diet, because how does that affect arthritis? Because I think that's what a lot of studies have been focused on.
Yeah, so most of the studies have been focused around the Mediterranean diet, around cardiovascular health, but as well as arthritic conditions. So really the premise of the Mediterranean diet is to make sure that you have low refined sugar, high in fiber, so fruits and vegetables, and primarily in vegetables as opposed to the fruits for the low sugar, as you previously mentioned. And then making sure that you have enough healthy fatty acids. So eating things like salmon or mackerel on a regular basis. Those will make sure that you get enough of the anti-inflammatory foods in your diet through the oils. And
what are your thoughts on someone eating red meat occasionally? Like, I know that it can be a bit more pro-inflammatory because of an arachidonic acid, but should someone have no red meat, or what's the balance?
Yeah, so it's definitely a balance. I would say sort of like 90 to 95% of the time you want to stick to your leaner cuts. So things like chicken, turkey, fish. But red meat every once in a while, you know, and what is occasional to me is not necessarily occasional to someone else. So limiting it to, you know, once or twice a month at max. That I think, especially if you're in sort of more of the severe arthritic stages.
So maybe you can have your steak once in a while for a special occasion. Okay, lovely. Okay, guys, so that was sort of the foundation of what you would want to do if you have or are trying to prevent arthritis. Now we're going to go on to some of the supplements you might want to add in on top of your exercise and your diet. So I'm going to ask Christine's opinion on these, but this is sort of what I've pulled just from studies right now and what seems to, you know, be in health food stores. You go to a joint section in every health food store, and they have all of these supplements for your joints, and it can get very confusing. But these are the ones that do have research backed or have clinical research behind them. So probably the most popular one is glucosamine. Right now, glucosamine has a lot of clinical research behind it. More specifically, glucosamine sulfate versus hydrochloride, I believe, is the one that's better. But it helps with the repair of cartilage. Now there's chondroitin as well. Now chondroitin has cartilage particles in it, but apparently it's not as effective as glucosamine because it has larger molecules and it's not as absorbable. Like glucosamine, I think, is around in the 90% range for absorption. Chondroitin more like the 13 to 15%, but for some people it does work. Now for chondroitin specifically, is that something you've ever used, or what do you find?
I have used it in the past, and a lot of times now you'll find it more in combinations, so glucosamine plus chondroitin. But I've actually found that it's hard to measure certain results. So if you're sort of looking at pain management or decrease in pain symptoms, as well as increase in daily functioning, I found that it takes just a really long time to work. And so some patients, they might really benefit from it, and others they may not. So it's sort of a cost risk or cost benefit analysis there. And I'll always have that discussion with patients.
And they probably just want to be on it a while to basically see results, right? Which is what, like months, ballpark probably at the minimum?
You're looking at a minimum of 6 months sort of thing.
Okay, so it really does take a long time. So guys, don't start popping glucosamine pills thinking in 1 week you're going to start seeing results then. See it as a long-term thing to take, I guess, to complement whatever else you're doing, right? Okay, so moving on, there are some other ones. Hyaluronic acid injections we did talk about, which I know Christine is a fan of. There's SAMe as well, which also helps prevent the degradation of cartilage if you have a deficiency in SAMe. So that's another one that does have research behind it. And I do believe we have a question I'm getting signals. So let's see, what questions are there? Oh, actually, this is a great question because I didn't mention this one over here. What results have you seen with the addition of MSM?
So I would say similar to the glucosamine and chondroitin. For some people, they respond better to MSM, but usually, again, it takes a bit of time, and it'll also depend on the quality of the product.
Okay.
So, you know, when you walk into a health food store, there's sort of a million options that you have. So it's going to depend. It's very individual, and I know that's a really...
So there isn't like a type of MSM specifically to look for? It depends on person to person?
Yeah, the form of MSMs, the different forms of MSM, I'm not super familiar with. I just know that from clinical experience and the research that I've done, it seems to perform better research-wise than glucosamine and chondroitin. But clinically, I haven't seen super great results.
Okay. Yeah. And is it MSM, and correct me if I'm wrong, I believe MSM is more anti-inflammatory versus helping repair the cartilage, is that right?
Yeah, so and I mean, just in general, it's really hard to regenerate cartilage, right? Like that pretty much doesn't happen. So just keeping that in mind, that you may not actually see changes on repeat x-rays and that sort of thing. It's all about symptoms.
Okay, okay. So that was a key point that she mentioned there too, which I want you to make sure you guys really took that in, is that it is rare or really hard to see significant change in repairing your cartilage. So the best thing you can do is number one, prevention. Number two, if you do have some degradation already, you can help slow down the rate of degeneration and prevent it from further breakdown, and opt for pain relief and managing the symptoms, right? But don't expect perhaps crazy results with like significant change, maybe a little bit in your cartilage if. Okay, so those are some of the main ones. NEM as well, natural eggshell membrane, is one that is becoming a bit more popular in human trials that they've done. They've seen that that provides significant pain relief as well. And of course, certain vitamins and minerals as well, just to help with joints. Things like vitamin C that help boost collagen, which is what makes up some of your cartilage. Are there any other vitamins and minerals you would say that are helpful that you've seen?
I would say that, and this is sort of maybe coming out in health news these days, but magnesium, suboptimal magnesium levels are sort of really coming out these days as sort of like a factor in major diseases. So when you look at just the ability for magnesium to act on multiple systems, so neurologically, so on your nerves, on your muscles, as well as, you know, other places, so in your heart and that kind of thing. I think it can play a pretty big role as well.
We're big fans of magnesium, everyone in the Hearty Soul audience is, so that's awesome. They'll be very happy to hear that. We do have another question. Almer says, hi Almer, sorry if I'm getting this totally wrong. Sometimes I feel pain in the backside of my knee. What could that be? So again, we would have to do an entire like medical history. Like Christine would have to sit down with you, of course, to see what's going on. It's very hard to say just behind a screen. But is something like a pain in the backside of a knee, is that something that could be arthritis?
Typically, osteoarthritis will present with like knee pain more in the front or sort of in the inside, but it sort of is going to depend on where what part of the joint is affected. The back of the knee, I mean, it could be sort of a Baker cyst sort of thing. It could be ligamentous, could just be sort of overall swelling, or so there's a whole number of things that it could be. Yeah.
Okay, hope that helps. Awesome. So again, those are just some of the supplements that I have found in studies, but I know that Christine is a much bigger fan of these ones, the actual anti-inflammatories, which is what people seek more, just that pain relief. So I don't know if you want to walk through some of your favorite ones here.
Sure. So the first two, curcumin and boswellia, so those are the ones that I use most often, I would say. And now with some of the professional formulas that we have, there's sort of combinations. So curcumin is a specific constituent found in turmeric. So adding turmeric to your diet is great, whether it's in curry, smoothies, whatever. But you're not going to get the same amount.
You're not going to get the same potency, right?
Exactly. So. Even when choosing natural health supplements, you definitely want to look at the percentage of curcuminoids or active curcumin products. So that can make a pretty big difference. So you'll see maybe some that say just turmeric, and then it'll say 10% curcuminoids or something.
Okay.
And so you know that's sort of a bad quality.
What's the percentage that someone should roughly look for turmeric?
I mean, with professional lines, you'll see as high as like 90%.
Oh, wow.
So primarily using curcuminoids, but that you have to keep in mind is going to increase the cost, right?
Yeah.
So people will be like, oh, well, this one's only 16, this one is 50, I'm going to get the $16 one, without really considering the actual dosage that's in each capsule.
Yeah.
So lots of companies will have their own proprietary strains, so that will make a difference as well.
Yeah, so I've heard of specific ones. Actually, well, there's one that I did give a client before, and again, it was one of those more expensive ones, but it really, really helped her.
Yeah.
It was Long Vita,
Okay.
and I know there's another one called Meriva. Are there any others, and is there one that you like in particular?
So those are good options. I use other companies like NFH, and I don't think they have a proprietary necessarily like a name for theirs.
Okay.
But yeah, I like those ones as well.
Okay.
Yeah.
Awesome. And the key thing with these ones, guys, so you understand why there's specific formulations. As you know, with turmeric, it is fat soluble. Same with the curcuminoids. So to help with the absorption, what companies do is they bind it to a type of fatty acid, let's say, it's called phospholipids. So it's bound to that fat, and that's what helps the absorption. So definitely look for that, and that's why you want curcumin, I guess, bound to something in a product. What are your thoughts on some of these other ones like ginger and devil's claw?
Sure. So I'll start with boswellia because I don't think we really talked about that yet.
Oh yeah.
But with boswellia.
Sorry. Just skipped on. So excited about turmeric. Yeah.
So boswellia is another herb.
Yeah.
And the component that's particularly active as an anti-inflammatory is known as boswellic acid. So that's sort of the key word or the key words that you want to look for when you're picking a boswellia supplement. So with boswellic acids, you're looking at it as primarily an anti-inflammatory. So it acts on certain enzymes in the inflammatory cascade. So 5-lipoxygenase, I believe it is, with boswellia in particular. So just one part of the chain there.
Okay.
Yeah, and then ginger is just sort of great as an all-around, not only sort of for the digestive system, but also as an anti-inflammatory. It's traditionally used in Ayurvedic medicine as well as that.
Cool. We do have a question actually from someone before we even talk about the last two.
Sure.
So we have Petya. Hi, Petya. She's asking, would you please recommend specific brands for the anti-inflammatory supplements? So I guess after we've talked about the last two, perhaps if there's any brands that you really like, and if you know of some that are perhaps in the US or more globally available too, we can touch on that.
Yeah. So with the Long Vita curcumin, I'm not sure if this is the one that you used, Alina, but AOR, I think they're
That was the one. I love AOR. I know, I think you can get it on Amazon, guys. It's a Canadian-based company. We're in no way affiliated, by the way. I used to work at a health food store for around 2 years, and with my clients too, and for personal use too. AOR has amazing formulations, and they're usually a bit more price friendly as well. But yeah, so AOR.
Yep, so AOR for herbs, I like MediHerb as well. So they'll have Boswellia complex that sort of combines a couple of these up here. NFH is a Canadian one primarily, and then I believe Thorn has some US traction as well. So those are sort of the ones that I stick to, and so it's not sort of your general health food store brand or that sort of thing, because we sort of like to use the professional companies that do a lot of research behind their stuff.
For sure. Awesome. So I hope that helps you, Petya. We have another question from Cynthia. Hey again, Cynthia. She is asking, so this was in relation to the turmeric. She's asking, okay, and when I said you need fat to absorb it, she's like, oh, but pepper too, right? What's the story there?
So yeah, for sure, black pepper has been shown to increase availability and increase absorption of turmeric. So that's why.
But it's not necessary, I guess, for absorption?
I don't think it's not necessary, like necessarily, but it does definitely increase the bioavailability. Yeah, exactly.
And what about, do you ever find it in supplements? Like I've seen piperine, I don't know if I'm saying that right, guys, but I know some people avoid putting that in supplements.
Probably because of sensitivity reasons. Maybe cost type stuff as well.
Okay, so maybe bottom line, it will help increase bioavailability, but you don't necessarily need it, and I don't think you're as likely to find it in supplements, so don't worry about that. Just go for the regular curcumin supplement that is bound to a fat, and you're good. Cool. Okay, I think that was it for the questions right now. Anything you wanted to add on bromelain or devil's claw, aside from they're awesome?
So I guess with so devil's claw kind of falls into the anti-inflammatory herb category. Bromelain is also used as like a digestive enzyme, so you could have dual action there depending on how you're using it. So if you're using it before meals, it's going to act more on the digestive system versus away from meals. That bromelain in combination with other digestive enzymes or other enzymes in general.
And bromelain is the one that comes from pineapples, right?
Yes.
Okay. Yeah, because I've seen, I don't know if you guys have ever noticed this in some restaurants, they sometimes, not some restaurants, it's like one steakhouse I went to, they give pineapple before you have the meat, I guess, to like increase the enzymes and activity, which was really cool.
Yeah, I don't know if like the actual pineapple, the fruit itself, like the stuff that we typically eat, has significant amounts of it. I think that's sort of just one of those like
maybe I was thinking too much into it. No. Maybe I was like, oh, it's because of the bromelain, but really it was just like, here's a pineapple. Okay.
It's delicious, regardless.
I learned something. Okay, so number 4, guys, stage number 4. Now we talk about actually fixing your gut. Now this is crucial for anyone overall. Obviously, you just want to improve your gut's health to reduce inflammation, boost your immune health, overall feel amazing. But I have put in brackets there RA, because this is so important if you have rheumatoid arthritis, because a lot of it is affected by your gut health. So here are some of the things that you would want to do to start fixing your gut and healing a leaky gut. Of course, the first thing, which we talked about, real food diet, more plant-based. Some people do find it to be helpful on a vegetarian diet, but of course that doesn't mean exclude, animal protein if you don't want to, but cutting back on it has helped some people because it can be a little pro-inflammatory at times, especially things like red meat. An elimination diet, which I will turn to you, Christine, to explain, what an elimination diet is and how that can help.
Sure. So an elimination diet is sort of synonymous with an anti-inflammatory diet in my sort of experience. So basically, with an elimination diet, there is a formal reintroduction period of foods. So there's the initial taking out or eliminating major high sensitivity foods, basically. So things like refined sugar, as well as gluten, dairy, red meat, sometimes soy, corn, like depending on sort of what you're dealing with. And I try to just take out the biggest offenders initially, but there are very strict ones as well. So, and even nightshades, especially with the arthritic conditions, they can affect a lot of people. So.
And we did have an episode about this before, guys. If you are curious about nightshades, Nadia and I talked about this in the past. Whether they're good or bad, and it comes down to really, if you have a bit of a compromised gut function, then yes, you could, you definitely could be a bit more sensitive to it. So just worth trying to take it out, like she said, an elimination diet. Of course, doing things like trying to eat more organic where possible. I know it's hard. It can be hard to find those things, or it can be a bit expensive, but just as close to local and homegrown, I guess, as possible, and limited in pesticides. Of course, there's things like actually fasting be interesting as well, because when you fast, it helps sort of repair your gut lining as well and regenerate that lining. Is that something that your clients ever do, like intermittent fasting, or does that help them?
I would say for a certain percentage, it does. And it's sort of mostly, though, I think, around changing what they eat as well. So although the timing of meals is really important, I think it's mostly the change in the content of what they're eating. So as you mentioned, with eating whole foods primarily, so you're increasing your vegetable intake and stuff like that. But for some, especially those who tend to eat sort of throughout a lot of hours in the day, that intermittent fasting might be beneficial, and also intermittent fasting is useful for weight loss.
Ah,
so that can
kill
be
two birds with one stone.
Yeah, but
Okay,
you definitely
I
want
like
to
that,
sort of
yeah.
have some guidance around
Yeah,
there,
for
and,
sure.
and see what else is going on in your body
Definitely.
before you start.
Okay, so we actually do have a question that I think I missed earlier. And someone was asking about magnesium. So Pat, hi Pat. So Pat was asking, how much magnesium should I be taking daily? So maybe we can give a general recommendation and then like a arthritis one.
So I'm like, I'm very liberal with magnesium. Sort of have to determine whether or not there's things where high dose magnesium might not be beneficial. So if you have like very low blood pressure or prone to looser stools or that sort of thing, then I would probably rethink how much magnesium I give. But in terms of sort of benefit overall, I would say minimum of 200 milligrams daily of a good form. So I tend to like the glycinates, the malates over
How do you feel about the citrate?
It's not bad. I just feel like now there's
so many better absorbable ones.
So like citrate used to be sort of the standard, and now although it's cost effective, I find that improvement comes with different forms. So,
okay, awesome. And actually, speaking of recommendations, I know that the audience would probably love a recommendation for probiotics as well. Like, what's a good general probiotic in terms of like number of strain or like CFU levels?
So just as a maintenance dosage, I would go with sort of like 10 billion CFUs of a multi-strain. So you have your lactobacillus, and then you have your acidophilus and all that kind of stuff. So each one of those strains has been researched for different conditions specifically, but just as an overall for good health, I would do about 10 to 15 billion CFUs.
Okay.
Yeah.
And everyone should sort of start off a little easy, I guess, too, and see, right? Because sometimes people can be very prone to like gassiness or bloating. I mean, it's rare. I haven't seen it, but I know one or two people were like, "Oh my God, I get so bloated."
Well, that might be more of a symptom of SIBO. So with the bacterial overgrowth that we mentioned earlier. So because the theory is you're adding more bacteria to your intestines where it's not liking it essentially. So with a probiotic, you're just sort of worsening the SIBO.
That's a really good point.
Yeah.
Learned something again. Thank you so much. Okay, so that was stage number 4, guys, fixing your gut. And then the last thing, so we've covered so many things that you can do for arthritis right now. The 5th one is sort of more what you can do above and beyond, those extra therapies. So things like acupuncture or Tai Chi that, you've heard of, read about, you're like, I'm kind of scared, don't know how to do these, but apparently they work. So again, I'll let Christine sort of walk through some of these because I know, she's very familiar with TCM and acupuncture as well, and how some of these things can help.
Sure. So acupuncture is like one of my all-time favorite modalities. I try and use it with everyone, but it's sort of more of a time commitment. So
also Nadia, by the way, she tried to stick needles in me the first week I met her.
Maybe we have to do a session of acupuncture live. So acupuncture specifically, in my experience, with the knee. So knee osteoarthritis is where I've seen huge benefit for it in practice. After I've had patients say even after one session they noticed improvement, which is great because that's sort of like what you want to see, and then over time, so usually I'll do one session a week for about 4 weeks, and then sort of see where they're at. If they don't notice any change in 4 weeks, then I'll sort of rethink my acupuncture route. With regards to what it shows in the studies will actually be pretty conservative, so they'll say one session a week for 5 to 23 weeks. So it's a huge range of benefit time. But I find depending on sort of the area and that kind of thing, acupuncture can be a very big
Now, who can
benefit.
people, let's say if someone doesn't have a naturopath close by, is there anyone else who's licensed to do acupuncture usually?
Yeah, so it'll depend on your state or province, but some chiropractors will be licensed, some physiotherapists maybe. Those two in particular won't necessarily do sort of a constitutional picture. They'll sort of go more in the neurofunctional sort of way.
Okay.
Otherwise, your TCM practitioners will sort of be your primary.
Definitely, they will know. And that means traditional Chinese medicine, guys, in case, sorry, we're using lingo sometimes, like TCM. Yeah, so acupuncture, definitely huge.
Yeah.
Relaxation, by that over there, I mean things like even music. So again, there was a study done which showed that people who were listening to music versus people who weren't had a lower perception of pain with their joint pain and arthritis too. So that's kind of cool. That's like an additional easy thing maybe you can do. Analgesics, I know you're a fan of.
We talked about analgesics, I guess, in the sort of Tylenol and Advil sort of sense. But this being more of the topical analgesics, so you can find lots of things out there with specifically like eucalyptus, camphor, and menthol. So like mint, eucalyptus, and camphor, which is sort of one of the components, I believe, in like cayenne pepper sort of thing. So the capsaicin as well. Yeah.
And what do you think of those sprays, like those deep heat kind of sprays, you know, the ones that have a really strong smell?
Yeah.
And it works for just like, I use it for like muscle strain sometimes, but is that something that you would recommend?
And ultimately it sort of depends on the symptom picture as well. So for example, if someone has like really hot and fiery joints, then maybe heat isn't going to work for them. Maybe they would benefit more from ice or contrast or something like that.
So I'm going to have you elaborate there, because that's a question too that I think people will want to know. In what situation do you want to use cold therapy, and in what situation do you want to use heat when it comes to arthritis and joint pain?
Sure. So arthritis is one of those things where it's chronic, right? So you're sort of past that acute phase where the theory behind icing with acute injuries is there. My beliefs around hot and cold and what's best is really what feels good for the patient or the person. So for some people, they might really benefit from heat because it's relaxing to the muscles and that sort of thing, whereas other people might prefer the cold, as I mentioned, because they might have really swollen and hot joints to begin with. So it's totally dependent.
Okay, cool, thank you. Is there any other extra therapy that you want to talk about, or do you feel like we've covered a lot?
I think we've covered a lot, but
maybe overwhelms people with information.
With the relaxation, I mean, I'm a huge proponent of mindfulness-based treatment as well. So meditation, I mean, it can't be said enough, the changes that it can make in your brain and then affecting your ability to process pain. So that is sort of something as a foundational piece almost.
Okay, awesome. Well, thank you so much for all of your insight and your experiences. Before we go, is there any case study actually, or sort of protocol or biggest change you saw in a client who had a lot of pain?
I would say so. There's two, and they happen to be male patients. So one was about 65. One was, I think, 56 or something like that, 56 years old. So the first one, the 65-year-old man, he came in, and this was when I was an intern actually at the naturopathic college. He came in, and his primary concern was pain, so knee pain specifically. So I remember sort of being an intern and thinking, okay, like I've never really done this before, but I'm just going to go back to my schooling and sort of try and figure out what might work. So I remember all I did was acupuncture, and then I think I recommended a fish oil maybe, because that was sort of like my favorite thing at the time. And then some contrast showers at home. So contrast showers being like
hot and cold.
Hot and cold, exactly. Right. So 60 seconds hot or warm, and then 20 seconds cold for like 5 cycles. So he came back after that initial visit, and he was like, "My knee has been great. I've been able to walk."
It's amazing.
Like, it was awesome. So I was really, like pumped, and that's sort of one of the key, or one of the best sort of examples of like arthritic related pains. Benefiting from.
That's awesome.
Natural.
And contrast showers probably is good for anyone to do, right? Even if you just have stiff joints, you don't need to have arthritis. It's just, I have stiff joints sometimes in the morning.
Yeah, exactly.
So I can do that too. Okay, Awesome. Well, thank you again.
No, thank you.
Thank you guys so much for tuning in. If you have more comments, you can write them in after we've gone off the air, and I will respond to them tomorrow or tonight. So yeah, thank you so much. We'll be here again next week. Christine, if people want to find you online, where can they find you?
So my website is www.drchristinecho.com. I'm also on Instagram, Twitter. I think Instagram is at Dr. Dr. Cho ND. I try and be active, but sometimes.
No judgment. Go give her some likes. Give her some love. Okay, cool. Thanks again, and we'll be back here next week at 7 o'clock EST, guys. Thank you so much. Bye.
Thank you so much for being with us today on YouTube.
Make sure you never miss an episode by hitting the subscribe button below. We do upload videos every single week.
And if you missed last week's video, you can check that out right over here. And make sure you check out our other awesome videos, including our other show, Real Food Live. It's amazing.
Right here.
And make sure you let us know comments and questions below.
Yeah.
We'll see you next week.
Bye, guys.